Have you ever wondered why your knees feel like they're betraying you? Why every step up the stairs feels like climbing a mountain? Why getting out of bed in the morning has become a daily struggle that leaves you wincing in pain? If you're nodding your head right now, then what I'm about to reveal in this video could be the most important information you'll hear all year. Because the truth is, millions of seniors just like you are unknowingly damaging their knees every single day, thinking they're doing something good for their health. You see, there are 3 exercises that are being promoted everywhere as healthy and beneficial for older adults. Your doctor might have recommended them. Your physical therapist might have shown them to you. You might even be doing them right now, believing you're taking care of your body. But here's the shocking reality that nobody wants to talk about. These 3 exercises are quietly destroying your knee joints, accelerating cartilage breakdown, and speeding up the aging process in ways that could leave you dependent on others for the simplest daily tasks. The most terrifying part? The damage is silent. It's gradual. It's happening right now as you watch this video, and you might not even feel it until it's too late. Until that morning when you wake up and realize you can barely stand without help. Until that day when walking to your mailbox becomes an impossible challenge. Until that moment when you understand that your independence has been stolen from you, one damaged knee joint at a time. But here's what gives me hope, and what should give you hope too. Once you understand what's really happening to your knees, once you see through the lies and misconceptions that have been fed to you for years, you can start to reverse this damage. You can begin to restore your mobility, reclaim your strength, and protect your precious independence for years to come. My name is Dr. Johnson, and for over 30 years I've been working with seniors who have been failed by the traditional medical system. I've seen the devastating effects of well-meaning but misguided exercise advice. I've witnessed the heartbreak of patients who followed their doctor's orders religiously, only to find themselves worse off than when they started. And I've discovered the truth about what really works to keep your knees healthy and strong as you age. What I'm about to share with you today isn't just theory. It's not some academic research that sounds good on paper, but fails in real life. This is practical, proven information that has helped thousands of my patients avoid knee replacement surgery, eliminate chronic pain, and maintain their active lifestyles well into their 80s and beyond. You're going to learn about the 3 exercises that are silently destroying your knees. You'll understand exactly why these movements are so dangerous for the aging body and how they're accelerating the breakdown of cartilage and joint tissue. More importantly, you'll discover what you should be doing instead. Safe, effective alternatives that will actually strengthen your knees and protect them from further damage. But before we dive into this life-changing information, I need to know that you're serious about your health. I need to know that you're ready to make the changes necessary to protect your knees and preserve your independence. If you're watching this video because you're genuinely concerned about your knee health and you want to take action, type the number 1 in the comments below. If you're just here out of curiosity and you're not really committed to making changes, type 0. Your response will help me understand how to better serve viewers like you in future videos. Also, if this information is going to help you make better decisions about your knee health, please hit that subscribe button and ring the notification bell. This channel is dedicated to providing seniors with the truth about health and wellness, the kind of information that the mainstream medical system often overlooks or ignores. Your subscription helps us reach more people who need this vital information. Now, let's get started with the first exercise that's secretly destroying your knees. This is an exercise that's recommended in gyms, physical therapy clinics, and senior centers across the country. It's considered safe, beneficial, and appropriate for older adults. But the truth is far more sinister. Traditional squats have been hailed as the king of exercises for decades. Personal trainers love them. Fitness enthusiasts swear by them. Even many doctors recommend them for building leg strength in seniors. But here's what they don't tell you. Traditional squats, especially when performed by people over 60, can be one of the most destructive movements for your knee joints. Let me explain what's really happening inside your knees when you perform a traditional squat. As you lower your body down, your knees travel forward over your toes, creating what biomechanics experts call anterior knee translation. This forward movement places enormous pressure on your kneecap, grinding it against the thigh bone with forces that can exceed 3 times your body weight. Now, if you're 25 years old with healthy, well-hydrated cartilage, your knees might be able to handle this stress, but if you're over 60, your cartilage has already begun to thin and lose its shock-absorbing properties. Every traditional squat you perform is like taking sandpaper to an already worn surface, gradually wearing away the precious cushioning that protects your knee joint. Think about it this way. Imagine you have a beautiful antique chair that's been in your family for generations. The upholstery is starting to show some wear, but it's still functional. Now, what would happen if you repeatedly dragged a heavy object across that delicate fabric? Eventually, you'd wear right through it, destroying something that could have lasted for many more years with proper care. That's exactly what's happening to your knees with traditional squats. The repetitive grinding motion is wearing through your cartilage, creating microscopic tears and inflammation that accumulate over time. You might not feel it immediately, but every squat is contributing to the gradual breakdown of your knee joint. But the damage doesn't stop there. Traditional squats also place tremendous stress on your knee ligaments, particularly the anterior cruciate ligament, commonly known as the ACL. This ligament becomes less elastic and more prone to injury as we age. The deep knee bend, required in traditional squats, stretches this ligament beyond its safe range of motion, creating micro tears that weaken the structure over time. I've had patients come to me after months of doing squats religiously, wondering why their knees feel worse instead of better. They followed their trainer's advice. They used proper form. They started slowly and gradually increased their repetitions. But they were unknowingly participating in the gradual destruction of their own knee joints. Sarah, a 72-year-old patient of mine, is a perfect example. She started doing squats at her local gym because her doctor told her she needed to strengthen her legs to prevent falls. For 6 months, she dutifully performed 2 sets of 15 squats 3 times a week. She was proud of her commitment to fitness and felt like she was taking control of her health. But gradually, Sarah began to notice changes. Getting out of bed became more difficult. Climbing stairs required more effort. Her knees felt stiff and achy, especially in the morning. When she came to see me, X-rays revealed significant cartilage loss in both knees, far more than would be expected for her age. The squats she thought were helping her were actually accelerating the aging process in her knee joints. The problem is compounded by the fact that most seniors don't have the hip mobility and ankle flexibility required to perform squats safely. When these joints are stiff and restricted, the knees are forced to compensate, taking on stress and movement patterns they weren't designed to handle. This compensation leads to uneven wear patterns, joint misalignment, and accelerated degeneration. Furthermore, traditional squats require a level of balance and coordination that many seniors don't possess. The fear of falling backward can cause people to shift their weight forward onto their toes, placing even more stress on the knee joint. The instability created by trying to balance while lowering and raising the body can lead to sudden, jerky movements that can cause acute injury to already vulnerable knee structures. If traditional squats are bad for your knees, deep lunges are even worse. This exercise, often recommended for improving leg strength and balance in seniors, is actually one of the most destructive movements you can perform if you're over 60 and concerned about knee health. Here's what happens during a deep lunge that makes it so dangerous for aging knees. When you step forward into a lunge position and lower your back knee toward the ground, you're creating an extreme range of motion that places enormous stress on multiple structures within the knee joint simultaneously. Let's start with the front knee, the one that's bearing most of your body weight. As you lower into the lunge, this knee moves far forward over the toes, creating the same harmful anterior translation we discussed with squats, but often to an even greater degree. The deeper you go, the more extreme this forward movement becomes, and the more pressure you place on your kneecap and the cartilage beneath it. But it gets worse. The single leg stance required in lunges means that all of your body weight is concentrated on one knee at a time. Unlike squats, where the load is distributed between both legs, lunges force each knee to handle the full burden alone. For a senior with already compromised joint health, this concentrated load can be devastating. Now let's talk about the back leg, the one that many people think is just along for the ride. This leg is actually subjected to a different but equally harmful type of stress. As your back knee approaches the ground, the joint is forced into extreme flexion, stretching the ligaments and compressing the cartilage in ways that can cause significant damage over time. The twisting forces generated during lunges are particularly problematic for seniors. As you step forward and then push back to the starting position, your knee joint experiences rotational stress that it's not well equipped to handle. This twisting motion can cause tears in the meniscus, the C-shaped pieces of cartilage that act as shock absorbers in your knee. I want you to imagine your meniscus as the rubber gasket in a jar lid. When it's healthy and intact, it creates a perfect seal and allows the jar to function properly. But if you twist and stress that gasket repeatedly, it begins to crack and tear. Eventually, it fails completely, and the jar can no longer function as intended. That's exactly what happens to your meniscus when you subject it to the repeated rotational stress of deep lunges. The balance component of lunges presents another significant risk for seniors. The single leg stance combined with the dynamic movement of stepping forward and back creates a situation where falls and injuries are much more likely to occur. I've seen numerous patients who suffered serious knee injuries while attempting lunges, including torn ligaments, fractured kneecaps, and severe meniscus tears. Margaret, an active 68-year-old grandmother, learned this lesson the hard way. She'd been doing lunges as part of her home exercise routine for several months, believing they would help her stay strong and independent. One morning, while performing her usual set of lunges, she lost her balance and fell awkwardly on her front knee. The result was a complete tear of her ACL and significant damage to her meniscus, requiring surgery and months of rehabilitation. But even when lunges don't result in acute injury, they're still causing cumulative damage that adds up over time. Every deep lunge stretches your knee ligaments beyond their safe range, creating microscopic tears that weaken these structures. Your body tries to repair this damage, but the repair process involves inflammation and scar tissue formation that can actually make your knees stiffer and more prone to pain. The hip flexor tightness that's common in seniors makes lunges even more problematic. When your hip flexors are tight, they pull on your pelvis and change the alignment of your entire lower body. This altered alignment forces your knees to work at disadvantageous angles, increasing the stress on the joint and accelerating the breakdown of cartilage and other structures. Deep lunges also place enormous demands on the muscles surrounding the knee, particularly the quadriceps and glutes. While strengthening these muscles is important, the extreme range of motion required in lunges often exceeds what these muscles can safely control in seniors. When the muscles can't adequately stabilize the joint, the passive structures like ligaments and cartilage are forced to take on more stress than they can handle. Now we come to the most dangerous exercise of all for senior knee health. High-impact step-ups might look innocent enough, but they're actually a perfect storm of everything that can go wrong with knee exercises for older adults. This exercise combines excessive knee flexion, high-impact forces, balance challenges, and asymmetrical loading in a way that's almost guaranteed to cause problems for aging joints. Let me paint a picture of what's really happening when you perform step-ups on a high platform. As you place your foot on the step and begin to lift your body weight, your knee bends to an extreme degree, often approaching 90 degrees or more of flexion. This deep bending compresses the cartilage on the back of your kneecap against your thigh bone with forces that can exceed 4 times your body weight. But the real damage occurs when you step down. The impact of your full body weight landing on the lower leg creates shock waves that travel up through your knee joint. Your cartilage, which has already been thinned and weakened by decades of use, simply isn't equipped to absorb these repeated impacts. Each step down is like dropping a hammer on an already cracked surface. The asymmetrical nature of step-ups makes them particularly harmful for seniors. When you step up with one leg, that knee bears the full weight of your body, plus the additional force generated by the upward movement. This concentrated loading can cause uneven wear patterns in your knee joint, leading to one side of the cartilage wearing away faster than the other. Think about your car tires for a moment. If your wheels are properly aligned, the tires wear evenly and last for many thousands of miles. But if the alignment is off, one side of the tire wears much faster than the other, and you end up needing new tires much sooner than expected. The same principle applies to your knees during step-ups. The uneven loading patterns create accelerated wear on one side of the joint, leading to premature breakdown and the need for intervention. The balance challenge presented by step-ups is enormous, especially for seniors who may already have compromised balance systems. Standing on one leg while lifting your body weight requires precise coordination between your visual system, inner ear, and the proprioceptors in your joints and muscles. When any of these systems isn't functioning optimally, which is common in older adults, the risk of falls and injuries increases dramatically. I've treated countless seniors who have suffered serious injuries during step-up exercises. Frank, a 75-year-old retired teacher, was using step-ups as part of his cardiac rehabilitation program. He had been managing well for several weeks when one day he missed the step on his way down. The resulting fall not only injured his knee severely, but also broke his wrist and bruised his ribs. What was supposed to be helping his heart nearly cost him his independence. But even when step-ups don't result in dramatic falls, they're still causing insidious damage that accumulates over time. The repeated high-impact loading gradually breaks down the shock-absorbing structures in your knee, including not just the cartilage, but also the meniscus and the small cushioning pads called bursae. The meniscus damage caused by step-ups is particularly concerning because it's often irreversible. Unlike muscle tissue, which can regenerate and repair itself quite well, meniscus tissue has very limited blood supply and healing capacity. Once it's torn or worn away, it's gone forever. And without this crucial shock-absorbing structure, your knee joint becomes bone on bone much more quickly. High-impact step-ups also place enormous stress on the patellar tendon, the thick band of tissue that connects your kneecap to your shin bone. This tendon, which is already under constant stress from daily activities, can become inflamed and painful when subjected to the repeated high forces generated during step-ups. This condition, known as patellar tendinitis or jumper's knee, can become chronic and severely limit your ability to perform even simple activities like walking upstairs. The quadriceps muscle, which is the large muscle on the front of your thigh, is forced to work at extremely disadvantageous angles during step-ups. When your knee is deeply bent, as it is at the bottom of a step-up movement, your quadriceps is in its weakest position, but is being asked to generate enormous force to lift your body weight. This mismatch between muscle capability and demand can lead to muscle strains, tendon injuries, and chronic pain. Furthermore, the repetitive nature of step-ups creates what exercise physiologists call overuse injuries. These are injuries that develop gradually over time due to repeated stress on tissues that don't have adequate time to recover between exercise sessions. Your knee joint needs time to repair the microscopic damage that occurs during exercise, but when you're performing high-impact step-ups multiple times per week, you're not giving your body the recovery time it needs. Now that you understand the dangers of these 3 common exercises, you're probably wondering what you should be doing instead. The good news is that there are safe, effective alternatives that can help you build leg strength and maintain knee health without causing damage to your joints. Let's start with the alternative to traditional squats. Instead of deep, full-range squats, I recommend partial squats or wall sits. These exercises allow you to strengthen your leg muscles while keeping your knees in a safe range of motion. By limiting the depth of the movement, you reduce the stress on your kneecap and minimize the harmful forward translation of your knees. To perform a safe partial squat, stand with your feet shoulder-width apart and your back against a wall. Slowly slide down the wall until your thighs are parallel to the ground, or as far as comfortable. Hold this position for 10 to 15 seconds, then slowly slide back up. This exercise strengthens the same muscles as traditional squats, but keeps your knees in proper alignment and reduces the stress on your joints. Instead of dangerous deep lunges, try stationary mini lunges or supported step backs. These exercises provide the balance and strength benefits of lunges without the extreme range of motion and high injury risk. Start by holding onto a sturdy chair or countertop for support, then take a small step backward with one foot. Lower your body slightly, keeping most of your weight on your front foot, then return to the starting position. As an alternative to high-impact step-ups, consider low-impact marching in place or gentle step touches using a very low step, no more than 4 inches high. These exercises provide cardiovascular benefits and leg strengthening, without the dangerous impact forces and extreme knee flexion of traditional step-ups. Water exercises are particularly beneficial for seniors with knee concerns. The buoyancy of water reduces the impact on your joints while providing resistance for muscle strengthening. Water walking, gentle water aerobics, and pool-based leg exercises can help you maintain fitness and strength without putting your knees at risk. Chair exercises are another excellent option for seniors who want to stay active while protecting their knee health. Seated leg extensions, ankle pumps, and marching in place while seated can help maintain circulation and muscle tone without stressing vulnerable joints. As we reach the end of this important discussion, I want you to understand that the choices you make today will determine your mobility and independence for years to come. Your knees are precious resources that need to be protected and cared for, not subjected to exercises that cause more harm than good. The 3 exercises we've discussed today, traditional squats, deep lunges, and high-impact step-ups, might seem harmless or even beneficial, but now you know the truth. You understand how these movements are gradually destroying your knee joints and accelerating the aging process in ways that could rob you of your independence. But knowledge without action is powerless. Now that you know what's harming your knees, you have the power to make different choices. You can stop doing the exercises that are causing damage and start incorporating the safer alternatives we've discussed. You can take control of your knee health and protect your ability to stay active and independent for many years to come. Remember, every step you take, every movement you make, is either contributing to the health of your knees or detracting from it. There's no neutral ground when it comes to joint health. You're either moving toward greater mobility and independence, or you're moving toward pain, limitation, and dependence on others. I encourage you to share this information with your friends and family members who might be making the same mistakes with their exercise routines. Your loved ones deserve to know the truth about these dangerous exercises, and your sharing could prevent them from suffering unnecessary knee damage. If this video has opened your eyes to the reality of knee-damaging exercises and has motivated you to make changes in your own routine, Please give it a thumbs up and leave a comment letting me know which exercise you're going to stop doing. Your engagement helps this important information reach more people who need to hear it. Don't forget to subscribe to this channel and ring that notification bell so you'll be the first to know when I release new videos about protecting your health and maintaining your independence as you age. I'm committed to bringing you the truth about health and wellness, the kind of information that can truly make a difference in your quality of life. Thank you for taking the time to learn about this crucial topic. Your knees will thank you for the changes you're about to make, and your future self will be grateful that you took action today to protect your mobility and independence. Stay strong, stay informed, and remember that your health is your most valuable asset.